Mechanical ventilation alarms. 1. Alarm, high pressure limit possible causes secretions, coughing or gagging, patient fighting, ventilator/ventilator asynchrony, condensate, water, in tubing, kinked or compressed tubing, example, patient biting on endotracheal tube. Increased resistance, example, bronchospasm, decreased compliance, example, pulmonary edema, pneumothorax. 2. Alarm, lower pressure limit possible causes total or partial ventilator disconnect, loss of airway, example, total or partial extubation endotracheal tube or tracheostomy, cuff leak, example, patient speaking, grunting. 3. Alarm, apnea possible causes respiratory arrest over sedation, change in patient condition, loss of airway, example, total or partial extubation. 4. Alarm, high VT, minute ventilation or respiratory rate possible causes change in patient's breathing efforts like rate and volume, patient disconnection, loose connection or leak in circuit. Endotracheal tube or tracheostomy, cuff leak, example, patient speaking, grunting, insufficient gas flow. 5. Alarms, ventilator inoperative or low battery possible causes machine malfunction, unplugged power failure or internal battery not charged.